The last 20 to 30 years, our thoughts have changed about women and heart disease. We now know women frequently have different symptoms with heart disease, and although they may start their heart disease later in life, it might end up being more severe.
Yeah, and Go Red for Women, American Heart Association just had their Go Red luncheon. They spend the month of May trying to raise awareness all year long too, with February as well. But let's talk about this, especially for women. It's the #1 killer.
70 years ago, there was a Framingham study, and they really started talking about risk factors for heart disease. At that time, it was sort of a men's disease because men were having problems in their 40s and 45, were the aggressive workers, and women were pushed to the side. And then we found out that women began having heart disease later, and sometimes it was more severe. For instance, if they went into heart failure, their heart failure survival rates were less than the men's were. When they had heart attacks, they were different. Men were rushed to the emergency room where they would have a cath and procedures to open up the coronary vessels, whereas women would come in with exercise-caused fatigue and break out in sweats and just tired. Very non-specific symptoms, because we all get tired, we get fatigued if we're running. So when does that become different for women? Well, women need to be aware of their heart and aware of those symptoms. So if it's unusual fatigue, if you know you shouldn't be that tired, and maybe you have a breakout in a little sweat or feel discomfort or feel short of breath, and think about your heart and think about immediately going to the emergency room. Now, it may be that in women, the small blood vessels that go inside the muscles to the heart are where the damage is done. We know that when men go into heart failure, we measure how much the heart pumps. We call it ejection fraction. In women, they can have a normal ejection fraction, but still go into heart failure, and their heart failure survival rates are not as good as men. So women have a great deal of potential of having problems. How about hormones? We thought initially women didn't get heart disease until after they were menopausal. But we know now that hormone replacement therapy actually increases the risk of women having heart problems. So we need to be very careful about hormone replacement therapy, about activity of children, about the risk factors, about smoking, about being overweight, about being sedentary, about having elevated cholesterol and elevated
know your numbers,
blood sugar.
especially, yeah.
Know your numbers and pay attention to them and stay healthy. There's nothing better than seeing somebody that you know has been active and they're thin and they look good and they feel good and they're active and they say they feel great. But work that out with your doctor also. Be sure that you get appropriate evaluation.
Good information, Doc. We appreciate it.
It's always nice to be here.
Great seeing you, Doc. And you can catch the award-winning Dr. Bob Show at 9 p.m. on Sundays, at 2:30 p.m. on 10 News 2.